You are welcome to the Mirror TV.
Nigerian Reformed Church (NRC) opens branch of Sudan United Mission Hospitals for rural health services in OGUZAROWIYA village in Ebonyi State Local Government Area, Ebonyi State. The special ceremony comprised commissioning of renovated 5-bedroom bungalow health care center and foundation laying of a complete primary health care center containing 20 for inpatient and outpatient wards. Plus free health care was administered to over 150 villagers who came for medical checkups, tests, and treatments were administered respectively. The Rural Health Services (REH) Administrator, CMD, Rev.DR.JOESPH, MBAM, the pioneer of healthcare for rural services for the eradication of viral hepatitis B and C in Ebonyi State and beyond, with his collaborating bodies in his speech and in an interview assured the host community of his readiness to provide adequate healthcare and its equivalent to the community. He expresses his gratitude to God, NRC, Synod President, and board members for support that led to a success of the program.
My commitment is that, one, we have 5 staff stationed solely for this. And we have also volunteers, especially in the hepatitis project. We have 3 doctors that are working with us. We have a nurse. We have 1 lab scientist. We have 1 lab technician. So all with myself, with all this, we know that we are not going to abandon. And look at also the investment. So we have made a lot of investment and not abandon it. So let them not fear anything. We are already committed. So much happy, and I would wish to express my utmost thanks to God for making today a reality. This is a day that we have been waiting for, and today you can see that almost 1,000 people were here to witness the opening ceremony of this health center that is meant especially to screen hepatitis B and C, which is very, very prevalent in this environment. For hepatitis project, which has been supported by my friends, especially Benjamin Emery.
The REHS Administrator, CMD Rev. Joseph MBAM, emphasized on his dissatisfaction over the death of his church members caused by viral hepatitis unknown to them, but was discovered through prayer and inquiry, and this has made them soar into action for tests of many individuals who are ready for medical health care in the state. In conjunction with his supporters, Benjamin E. as the key supporter, Ministry of Health, Ebonyi State.
Several of my church members died of the hepatitis, and we did not discover it in time. And I have buried several of them. It is not only in the local church, but all other churches. I have buried a lot of them. So when I began to ask, what is this? They told me that there's a virus called hepatitis B or C, that you have 5 types, that B and D are not dangerous, but B and C are very, very dangerous. And here B is the most common. C is not common, but we discovered. So that is why I prayed, and the Lord answered, and He provided somebody, Benjamin Emery, who has been moved by God to help us get all the reagents that we need for tests, like strips and so on and so forth. And then we started. And at a certain point, when we approached the Ministry of Health, they started supplying the vaccine for free. But we need to buy the syringe, the needles, the strips, and also I need to transport my staff to several places.
The REHS Administrator, CMD Rev. N.NWIBO, in his words, "We have tested over 300 people on viral hepatitis B and C across villages in Ebonyi State, and if discovered positive, 30% and 50% discharge are given to those that don't have money and sometimes treated free of charge because of lack of financial capacity."
So we have gone to several villages In short, we have tested almost 3,000 people now, and some of them tested positive. And those who tested positive, we give them treatment, and if they don't have money, we try as much as possible to provide the treatment for free. But if the person has some money, sometimes they pay 70%, we pay 30%, or they pay 50%, and then we pay 50%. So that is number one. Number two, this place is very, very strategic. It's very close to town. And this health center belongs to the Nrc Church. And by His grace, it was at this material time that the synod asked me to take care of all the hospitals and health centers. So within me, and with the decision of the board, we decided to make this place a hepatitis screening center. That's why we were able to renovate this with the financial support from Benjamin. So that is number two, that this place belongs to Nrc Church, and the board is very much willing to partner with Farikot so that we'll be able to screen people, treat them here. Then thirdly, looking at the proximity of this place to town is very, very strategic, and our people need health attention. You can imagine almost 1,000 people were here today, and you see our health personnel, so many of them. So we thank God that everything went fine. We are all happy, and you see a lot of people that came. And today we offered hepatitis tests and vaccination for free.
The NRC Synod President, Reverend Jonathan Woji, who commissioned the renovated health center OGUZAROWIYA, NRC Som Hospital, and as well laid foundation of NRC at the Primary Healthcare Center OGUZAROWIYA, appreciate Reverend Joseph N.NWIBO and his working team for their steadfastness in advancing God's work through medical care.
Some of the hospitals that we have instituted are here to dedicate and open again, and equally to lay foundation of a very big church behind me, big hospital house behind me here. But the intention is to allow all the patients that would come here to be treated, and by His grace, the Lord will heal them. This is Sudan United Mission Hospital, OGUZAROWIYA. My advice to the management is to toe the line of His Excellency, the Governor of Ebonyi State, who has been helping us so much in terms of health care. It is also inclusive in his charter of needs. And so the church wants to toe that line of helping the public.
The Synod President, Reverend Woji, pledged on a large support to make sure that the project come to fulfillment, and he urged the host community to protect the facility and come out always for adequate health care in the place.
I also tell the general public and the catchment area here to rush and come for their help, because we have doctors, we have nurses that can easily attend to their health needs.
The village chief, Benjamin Kwegu, and the youth president, Mr. N.NWIBO Udubishi, expressed their gratitude of deep happiness towards management of the ROHS and urged the ROHS administrator, Reverend Joseph N.NWIBO, to be committed in making the health center to stand the test of time and promise to protect the facilities in the area.
Ọkwa Chilege onye mmetụkwu Afrịka lobu kọfụ ụlọ obepenta na foundation nọ mmehie bidoro nta kọfụ emegwegwa meekwa hoi anyị keta bụ ọzọ akaba adure nre oge ngwa ọrụ n'ọgbala kika bamda bụ ndoguzuru onwe bandu kposhole ihe na-ekata onwe obodo a etu a ogbonwe eteka anya n'ọdụ nta ma ọ bụ yuto ma ọ bụ ndị bọgbe ga-enye ụfọdụ adịghawele ihe arụrụ anyị leka ihe mihe bibe arụ anya ka beto onye n'oge ụtọ gasha agaga banye efusilokwa gụda bụ Chileke mara ihe ime onye onu betimega anyị na-ekika nta ndị bọgram ndị youth besle ekabe hana du pechekwa renre le ale boguzongu ya lohu moguzongu ya community chikotawarono soge ayara nyivele kika lutungwere nyo onye nyo hodle ekika.
I'm a labo youth on behalf of the entire youth. But in terms of I know I'm a labo youth no go ahead order. The orally narrow my hand monitor my orally site on both day and night. Anything we can cause a problem like site on it. But as far as the youth near quarter, don't anything like problem there.
Meanwhile, the project engineer Awoki gave the specification of the newly laid foundation of Primary Health Center OGUZAROWIYA and said the building have all that is required in a primary health care center.
So the building is a primary health center that comprises both inpatient and outpatient department, such that in the inpatient department we have about 20 bed wards that comprises male ward, female ward, women ward, and pediatric wards. So coming to the outpatient department, we have different facilities such as the nurse station, the consultation room, antenatal care, postnatal wards, antenatal wards, pharmacy, laboratories. We have wards, we have doctors' consultation rooms, we have nurse stations, we have WCs. In fact, everything needed in a primary health center, the building comprises of such.
So I'm representing Faricod. We have screened 54 persons of hepatitis B and C, and 3 persons were hepatitis B positive, and people that tested negative were vaccinated. And this hepatitis, what we do about it, what we do is creating awareness against hepatitis. We test people, we vaccinate them, and people that are positive are referred to the appropriate authority for more health care. And this hepatitis is very rampant. Like in the world today, 296 million persons or people, they are positive, hepatitis B positive. 58 million people are hepatitis C positive. 1.5 million people are suffering hepatitis B, chronic hepatitis B. And we've checked many places, and we do find people that are positive. We advise people the way to avert it, and the best way to avert it is to do the test. If they are negative, they should be vaccinated. That is the only way it can be prevented. And this disease is a silent killer. You might not know the symptoms. Most of the symptoms are attributed to other diseases like typhoid, like ulcer, and others.
They conducted tests for many people, and I'm among of those that being conducted the test, and they gave me drug after some tests. If you test negative, they will not give you drug. For example, malaria. If you tested positive, they will give you malaria drug. I'm so glad, so happy, and by special grace of God, God will continue to empower Reverend through him, that this place will develop more and more.
I will Jesus. I have the mass. Nada egdike Nigeria Reform Church here Muleka ge Onyishi Nigeria Reform Church Synod President Agbape Olwa Emehia Lema Chileke Kenna Mekenwa Mekumedunsa.
Ya leva Chileke Kenna Mekenwa Mekumedunsa Baye Gida Tokolo Agobri Baye Gere la.
The guests were entertained by OGUZAROWIYA choir, and a group of women performed the cultural dance. Anita Oli said, the Mirror TV. As we keep updating you in news, reportage, and lots more. For your product or business advert, live documentary, project works, or social cultural events, please call us on 08165 191946. The Mirror TV, we stand to give you the best.